In this module, the focus is on personal care for individuals living with dementia, covering various aspects such as bathing, dressing, nutrition, hydration, toileting, falls, and sleep. The content will explore specific concerns related to personal care and provide techniques and strategies to address and improve the personal care experience. Tailoring dementia care for adults involves creating an environment that prioritizes individual needs, promotes a sense of familiarity, and fosters meaningful connections. By employing person-centered approaches and adapting activities to each person's unique abilities, caregivers can enhance the quality of life for those living with dementia. Here are some ways to support someone with mental health challenges or dementia during bathing. Listening without judgment, reassuring them, ensuring comfortable water and room temperatures, respecting privacy, guiding gently without force, offering assistance, understanding their challenges, encouraging them to share feelings, letting them make decisions, and fostering a safe, supportive atmosphere. These steps promote comfort and well-being. Enhance bathing as a sensory experience by using decorative shower curtains, contrasting toilet seat colors, and soothing wall tones for a comforting environment. Add step-by-step instructions, pleasant scents, and towel warmers to create a calming atmosphere. These thoughtful design elements promote independence, positive emotions, and engagement.
My mother used to shower every day. Now, if I don't remind her, she refuses to bathe at all. If I try to help her, encourage her to take a bath, she argues with me and gets upset, says she's afraid of the water. What can I do? Mom, it's 8 a.m., time for your shower.
Oh, I don't need it. I don't want one.
Mom, come on, please. We've gone over this over and over.
No, leave me alone. Don't touch me.
Come on, it's been a week since your last one. You need one. Please, get undressed.
A person with dementia will often refuse, withdraw, or fight during a bath or shower. When you're helping someone to bathe, it's important to be sensitive and tactful and to respect their dignity. Remember, washing is a personal and private activity. Bathing can be scary for patients as dementia progresses.
Okay, Mom, it's noon. It's time for your spa treatment.
Oh, I don't really want to go.
But you love the spa. Makes you feel like a queen. Yeah, and after that, we'll go to your favorite restaurant for lunch.
Well, okay, I guess.
All right, good. Let's go. So first, let's start by unbuttoning your shirt. I'm gonna do the top button, and then can you help?
Okay.
Okay. Good job, Mom. Okay, Mom, I'm gonna put a little water on your toes. No, test it. See if it's okay. How's that feel?
It's warm.
Good. Now let's wash down there. Can you do that by yourself?
Yes.
Great. There you go. Okay, we're almost finished. I'm gonna turn the water pressure on low and fill up this cup with some water. I'm gonna stand up. You just sit right here. Okay? Just lean your head back and pour a little bit of water on you. And we're gonna gently massage your hair with your favorite gardenia scented shampoo. How does that feel?
Yeah.
Reassure your loved one that even though bathing is a very personal activity, you're happy to help. Ask how she feels and how she would prefer to do things. Here are some additional tips on how to help your loved one bathe. Be flexible on the time. If your loved one doesn't like to bathe in the morning, try a different time of day. If the word shower or bath causes anxiety, use a different term like spa or get clean. Make the bathroom inviting by using flameless candles, aromatherapy, or soothing music. It's important that your loved one feels safe. Install handrails and use a shower chair. Limit bathing to twice a week and give sponge baths in between. Let her know what you're about to do, one step at a time, and have her help as much as possible. Use a towel to drape over her to provide more privacy. If you don't have one available, consider installing a handheld shower head. Being able to aim the water can be helpful and less stressful.
Getting dressed for the day is another opportunity to enhance the quality of life of a person living with dementia. Physical appearance contributes to a person's sense of self. They may become upset with the process of dressing. Due to cognitive decline, they may not remember how to dress themselves, which causes more frustration. How can caregivers help individuals with dementia who struggle with dressing? Dressing difficulties can stem from factors like physical limitations, memory issues, environment, caregiver actions, and emotional well-being. Caregivers can assist by ensuring privacy and comfort, offering choices and preparing the clothing in advance. Avoid rushing during dressing. Focus on the individual's well-being. Break down the dressing process into simple steps. Support those facing cognitive challenges. Recognize signs of embarrassment and maintain dignity. These steps can help tailor a personal care plan that meets each individual's unique needs. More helpful tips: prepare clothing options beforehand to make dressing easier. Ensure clothing is suitable. Offer practical and comfortable clothing choices. Stay positive and patient, smiling and encouraging independence by letting the person dress themselves as much as possible. Keep tasks and instructions simple and validate their emotions and concerns throughout the process. Here are some tips for dealing with resistance to getting dressed. Limit choices and focus on comfort. Offer fewer clothing options. Lay out clothes ahead of time. Be patient and guiding, not controlling. Adapt to any desire to change clothes. Redirect and offer simple guidance. If challenges continue, try these strategies. Try again later when they're more willing. Redirect their attention elsewhere. Play calming music for a peaceful atmosphere. Speak slowly and give them time to respond. Seek insights from family members. Consider trying another caregiver if needed. Creating a dementia-friendly dining area is crucial for a positive experience. Consider these tips for dining. Keep it simple to avoid distractions. Ensure chairs and tables are at a safe height. Choose easy-to-hold utensils. Provide non-slip placemats and easy-grip utensils. Create a soothing environment with soft music. Use clear signs and personalized seating. Offer individual attention if needed. Adjust dining times to suit different routines. Train staff to be patient and empathetic. These tips help make dining easier, fostering a calm, supportive atmosphere for improved well-being and enjoyment. Nutrition tips. Offer a variety of foods from all groups. Stick to consistent meal times. Ensure enough fluids like water and herbal teas. Provide easy-to-eat options. Help when needed without being intrusive. Minimize distractions during meals. Serve familiar and preferred dishes. Use tools designed for easier self-feeding. Seek advice from a dietitian. These tips help ensure individuals living with dementia receive proper nutrition. How does a special placemat help someone with dementia during meals, and what features make it effective? An adapted placemat benefits individuals by creating a supportive dining setting. Its clear visual cues, compartments for different foods, non-slip materials, and easy-to-clean surfaces enhance independence, focus, and overall enjoyment during meals. Hydration is essential for individuals with dementia to stay healthy. They may forget to drink, which can worsen symptoms. It's important to offer fluids regularly and be flexible with preferences and routines. Reminders can help ensure they drink enough. Consistent fluid offerings and flexibility are vital to prevent dehydration and promote overall health in individuals with dementia. Managing incontinence involves understanding factors like cognitive decline, mobility issues, UTIs, and medication side effects. Implementing strategies such as toileting schedules, hydration, behavioral techniques, and environmental adjustments. Monitoring symptoms and seeking medical attention for UTIs, reviewing medications, and using incontinence products as needed. Training caregivers in communication techniques and seeking professional guidance for comprehensive support. Placing the bed in an area where the bathroom can be seen when a person awakes in the morning. By addressing root causes and tailoring interventions, we can effectively manage incontinence in individuals with dementia, enhancing their quality of life. Training caregivers in communication techniques and seeking professional guidance for comprehensive support is key. By addressing root causes and tailoring interventions, we can effectively manage incontinence in individuals with dementia, enhancing their quality of life. Here are some helpful tips. Assist gently and respectfully. Choose clothes that are easy to remove. Consider using pads or briefs for accidents. Install safety features like grab bars and non-slip mats. Prompt individuals to use the bathroom regularly. Monitor bathroom visits. Teach caregivers how to handle incontinence with care. Consult healthcare professionals for guidance. Following these tips can help manage incontinence and improve comfort for individuals living with dementia. People living with dementia are at higher risk of accidents due to several factors. Forgetfulness and poor judgment can lead to unsafe behaviors. They may struggle to identify fall risks. There are hazards in their surroundings. Balance and gait problems increase the risk of falls. Impaired fine motor skills contribute to accidents.
They say, home is where the heart is. But it's also where a lot of falls can happen for older adults. Fortunately, CDC's STEADY initiative is here to help you improve home safety to prevent falls, one room at a time. To make your home safer, you can take simple steps such as picking up the clutter off the floor. This includes shoes, mail, and throw rugs. Make sure your furniture is arranged so there's a clear walking path around rooms. You can install night lights throughout your home so you can see better in low light or when it's dark. When it comes to the kitchen, it's all about keeping things practical. Start by keeping items or utensils that you use often within arm's reach. And if there's something that's out of reach, always make sure to use a sturdy step stool with a handrail instead of a chair. Cleanliness is key. Make sure surfaces and floors are always clean, and if there's a spill, clean it up as soon as possible. If your home has stairs, remove clutter from the steps and make sure the stairway is always clear. Something else you can do is to have bright overhead lighting at the top and bottom of stairs. Make sure you have handrails on both sides of the stairs, that carpeting or runners are fastened down, and repair any loose or damaged steps. In bedrooms, be sure to have a light close to your bed. You can also make sure any rugs are fixed in place and secure. In bathrooms, consider adding non-slip rubber mats or strips in the shower or tub. You can also install grab bars near the shower, the bathtub, and the toilet for support. Some projects can be too big to do alone. Remember to ask for help for things like installing lighting or handrails. These small changes throughout your house add up to make a big difference in helping you prevent falls. Visit cdc.gov/steady to get more information and helpful tips on staying safe, healthy, and independent.
Reduced mobility makes falls more likely. They may not be aware of common dangers like wet floors. Confusion in familiar settings raises the risk of accidents. These factors raise the chances of falls, burns, medication errors, wandering, and other accidents. To enhance safety, use assisted devices like grab bars or walkers for extra support. Adapting the home environment by adding handrails or rearranging furniture for clear pathways. Educate the family members and caregivers about dementia and safety. Develop an emergency plan and ensure everyone knows what to do. Consider safety alarms or monitoring systems for added security. Also, conduct regular check-ins with healthcare professionals to monitor the individual's condition. Implementing these steps can make the environment safe. Here are some sleep disturbances experienced by someone living with dementia: trouble sleeping, restlessness, confusion, and agitation in the late afternoon or evening.
My mother sleeps all day and keeps everyone awake at night. In the morning, we tell her to get up and do something, but all she wants to do is sleep. When nighttime comes, she's awake and keeps the whole house up. How are we supposed to get any rest? Go to sleep, Mom. Everyone else is sleeping. What are you doing awake?
I need to get ready for work. I don't want to be late.
What are you talking about? It's 2 in the morning. You haven't worked in 20 years. Please just go to sleep. I have to wake up for work in a few hours.
You don't know what you're talking about. You're just a kid. Now, you go back to sleep, and I'll wake you up when it's time for your school.
School. Please, just go to sleep. Would you just stop bothering everyone
Who am
already?
I bothering?
I'm going back to sleep.
Sleep disturbance is a common problem in dementia. Some patients may mistake daytime for the nighttime, while some sleep excessively in the morning and stay awake at night. They may wake up in the middle of the night confused and disoriented. This presents safety issues such as falling, wandering, and other unsupervised behaviors. For some patients, sleep disturbance is caused by or made worse by excessive napping, lack of daytime activities, and not enough exposure to sunlight. Medication effects, caffeine, alcohol, and pain can disrupt sleep-wake cycles. In any event, if your loved one is awake at night, stay calm and be patient. Keep in mind that how you respond to the situation greatly affects the outcome for your loved one.
What are you doing up, Mom? Do you need some help?
Oh, no, I need to get ready for work. I don't want to be late.
Hey, Mom, it's actually 2 in the morning, see? Everyone else is sleeping. It's not time for work yet.
Oh, but wait, what are you doing up there? You should go back to sleep. You have school in a few hours.
You're right. What would you say to a glass of warm milk? One for you and one for me. And then we'll both go back to sleep.
Sounds like a good idea. Oh, but we can't stay up too late.
I agree. Let's go to the kitchen for that milk then. You can help me warm it up.
Ooh, good.
Here are some tips to help minimize sleep disturbances and increase the chances of restful sleep. Maintain a regular schedule for meals, bedtime, and getting up in the morning. Seek morning sunlight exposure, but eliminate light from computers or bright lights 90 minutes before bed. Encourage daytime exercise several times a week, but avoid vigorous physical activity a few hours before bedtime. Limit naps to once a day, if at all, and no longer than 30 minutes. Keep the person busy during the day. Going to an adult day facility or having a friend or relative spend time with their loved one will help keep them awake and stimulated. Avoid alcohol, caffeine, and nicotine, which can interfere with falling or staying asleep. Avoid over-the-counter PM medications. Provide adequate pain management if appropriate. Provide night lights and fill the bedroom with familiar objects like family pictures to reduce disorientation in case the person wakes up during the night. If your loved one awakens, discourage them from staying in bed while awake. Use the bed only for sleep, and instead encourage them to move to a bedside chair and listen to relaxing music while keeping lighting dim and the room cool.
Getting out of bed and walking around at night poses risks. Sleep pattern disruption, leading to daytime sleepiness and nighttime wakefulness. Uncomfortable leg sensations that disturb sleep. Dementia-related nightmares can cause fear and restlessness at night. Interventions can include increased exposure to natural light. Avoid stimulating activities before bedtime. Maintain regular meal times. Consult a healthcare provider for medications. Consider a warm bath before bedtime. Offer comfort and reassurance. Ensure a calming and safe bedroom environment. Adapt these strategies to individual needs and speak with healthcare professionals for a comprehensive care plan to enhance sleep quality and provide support for caregivers. Caregivers can help by creating a calm environment for activities like bathing, choosing comfortable clothing, and offering nutritious meals, ensuring regular hydration and consistent toileting routines, implementing fall prevention measures, and promoting a sleep-friendly atmosphere. Adjusting approaches based on abilities and communicating clearly. Use flexible caregiving strategies and reassess regularly for a person-centered approach. Before we finish this module, let's go over a few questions to reinforce what you have learned today. These are general knowledge questions that we reviewed in this module. Feel free to go back in the module if you need a better understanding. For those seeking certification or CEUs, there will be questions of this nature asked in the post-test.